Hi, I'm Dr. Buik from Triskalia Wellness, and I wanted to tell you about dry needling. I get a lot of questions about dry needling, like does it hurt, what is it good for, and how do you do it? So I have my friend Wes here who is going to help us with this demonstration. And really what dry needling is used for is, you know, those knots that never seem to go away no matter how much you massage them or do other methods or stretching and all that stuff. So what dry needling does is it uses acupuncture needles, which are very fine needles. 5 acupuncture needles can actually fit in a syringe. So people are scared when they hear needle, but it's actually this tiny little thing that you can probably barely even see here. And it goes in an applicator tube, just like this, and then we put it on the skin. So what I'll do is, I'll find a trigger point, and a lot of people have big old golf ball trigger points in their upper traps because they're at the computer all day, and that posture over time, your neck muscles are straining and you create a trigger point right here. So I find that trigger point, and I just put the needle over it and I just tap it in. The needle's actually in now. Did that really hurt much, Wes? Yeah, so actually inserting the needle isn't very painful, but what we're going for is the gold standard of dry needling is we want a little muscle twitch. So we'll get in here. Oh yeah, Wes has great muscles with great twitch. And so I don't know if you can see it on the camera there, maybe we can zoom in, but his upper trap here is really twitching. And the whole point of why we're doing this is this helps break up that muscle that is contracted and won't let go. I'm gonna just leave this here for a moment, just twist the fibers around the needle and explain. So when you have a trigger point, the muscles contract and expand because the fibers are going forward and back. But when you have a trigger point, these muscle fibers are stuck, and then the blood flow stops in that area, and then you get a buildup of a bunch of chemicals, like inflammatory and painful chemicals. But what the needle does is it kind of goes in, breaks it up, and helps the whole area relax. And so by getting that twitch, we know that we hit the right spot of the muscle and then it'll relax. So even though dry needling can be a little uncomfortable in the moment and you usually do get soreness with it, it may not be immediate soreness, but usually by the end of the day, you're gonna know you got some dry needling done. By the next day, usually the soreness has resolved, and just drink lots of water and all that good stuff. And then you just pull the needle out, and that's it for that area. Now, a lot of times people will have, I notice, more in the area, like the upper trap might have 2 or 3 in it. You might have some of your scalenes, maybe some of the other postural muscles or where they attach up into the neck. So it's not usually just one needle. Usually we probably do maybe 5 or 10, or maybe you have some on each side. But that's the basics of what dry needling looks like. So not as terrifying. And what has been your experience, Wes?
Well, like immediately after, you just kind of feel like light, and I really like the tenseness in the muscles really kind of releases. And I do find, it feels a little bit sore afterwards, but kind of the next day or the coming days, you do notice a difference in like overall mobility, and just the overall feeling of like these places are wanting to be healed, kind of just wanting to release, which is nice.
Yeah, awesome. Well, thank you for watching, and I look forward to bringing you more informational topics. Thank you.